Hi, I'm Rahul Mishra, founder and CEO of Vesta Elder Care Private Limited. The Indian elder population is the fastest growing in the world today. We have 139 million elders as of now, and this is is projected to double by 2050. So the Indian elder care market is going to become huge. Also, the acceptance that elders require care is now widespread. There are care homes that are coming up, which was a very Western concept in the past, but now it's become quite commonplace. And care at home is still the preferred option, where people look after their parents in the homes. Also, with the proliferation of new cities, etc., people are moving away. A lot of people are moving abroad, and their parents are living alone, in high rises, in isolation, and so therefore, the need for care in homes for their elders is increasing. So the challenges of the elder care industry, have been well documented. Aging population across the world, people moving away, people moving to cities away from their families, etc. Caring for the elders, has always been an issue. In India, because of the attachment of families and our social, background, families tend to live more together, but this is also changing over time. People are moving to different cities, people are moving overseas, parents are living in their, in isolation. There are security issues, facing elders. We hear about crime, things like that. And then there are, of course, personal issues such as, health-related problems, the emergence of COVID, where the elders were considered a high-risk group, the lack of hospital infrastructure, people wanting to take care of parents in their homes because of, lack of beds, the, threat of infection and things like that. There is also a fragmented marketplace, where there are not so many service providers or, people catering to the specific needs of the elderly. We generally just look at hospitals when it comes to, care for everyone, including the elders. But elder care is a specialist domain. There are certain diseases, there are certain conditions, there are mental health issues that are faced by elders, which we are still, in the very early stage of discovering. We kind of tend to put it, brush it under the carpet, mental health, loneliness, all of these aspects. And so that's where I feel, the need for elder care specialists, elder care companies, people, trained specifically to look after elders, to provide support for families. There's a lot of guilt with, younger people whose parents are living away from them, or they are, moving abroad. There is a big, mental challenge that, you're always feeling guilty that, you're away from your parents. So, companies who can provide that support, that peace of mind, information, that I feel is, the biggest challenge, and we are looking to address that. So since COVID, technology has, played a big part in, looking after health of people in their homes. Right from, diagnostic companies, e-pharmacies, doctor consultations, and especially the management of health data. That is now, everybody has either an Apple Watch or, some sort of wearable device where they are tracking their steps. People have become more conscious of things like that. People are ordering medicines online. People are, doing doctor consultations online. And there are, other aspects such as, community engagement. Old people are, taking language lessons. People are doing, cooking classes. All of these things are helping in sort of, their mental health, apart from just the, the health aspects or, medical aspects. There are things like community engagement, having different communities over technology platforms. That is how technology is helping. And plus, maintaining all of that data, that data being readily available for health practitioners, for doctors, for family members, early detection of conditions by monitoring health data. Also, the role of AI, where people are talking about predictive health conditions, using AI by analyzing data. So that's where technology has already emerged as a key component of elder care and general healthcare. And I think this will keep increasing as time goes by. So I established Vesta Elder Care in 2019. This was actually, prompted by my own personal need. My mother, who was 78 at the time, required elder care, and I could not find any specialist company that was, tailoring, services that were, specific to elder care. There were nursing bureaus and there were, maids, etc. available, but nothing which I found was quality, providers of elder care. That's what prompted me to start the business. And since 2019, we have added different services to our portfolio. Apart from elder care, we have now ventured into nursing care and critical care at home. So our business is two-pronged. One is our tailored approach. So we match caregiver with patient or with the elder. We engage with the family. We have a critical, we have a clinical team that recommends the type of care that a person requires. And then we have a technology platform. The main USP of our business is the technology platform, where we plug in all the services on a single app, and we allow a family member to be able to transact, to be able to view, to be able to assign other family members into a family network and manage the care of the elder. All their health data, all their vitals, all their test reports, their prescriptions, everything is stored in the app. And we are now tied up with national players for other services such as diagnostics, such as emergency ambulance care. We are in the process of setting up a clinic management software which will enable us to onboard specialist doctors onto our platform, and also e-pharmacy. So all the services that are health related for an elder can be managed through a single platform. Another great feature of our platform is our Caregiver App. This Caregiver App basically allows us to remotely onboard caregivers. Caregivers can upload their documents onto our app. We look at them, and they then become a Vesta verified caregiver. When the caregiver checks into a client's home, their attendance is marked, everything is very transparent. This enables us to empower caregivers, to become responsible for their own lives, their own, economics, so to speak. So we have a team of 30 people. In the last 4 years, we built up a team, and also we have a network of more than 3,000 caregivers in Delhi, NCR, and Punjab. This we've been able to rapidly scale with the help of our Caregiver App, and we have a sort of multi-layered approach where we have a call center, a dedicated call center that provides support to any client that may require it. We have on-the-field teams that are there in case of emergencies. We are, like I said, we have a tie-up with an ambulance provider.